In this lesson, we're going to hit the high points of grief and loss. Okay, guys, for this lesson, we're really just going to focus on the high points of grief. There's another lesson on grief and loss in the mental health course that I really encourage you to go check out. And today we're just going to focus on some main concepts. Now, remember, grief is an emotional response to loss, and loss is being deprived of something. There's this idea that grief and loss only exist in death, which is absolutely not true. Loss could be removing someone from their life. So if someone's incarcerated, or if there's a breakup, or if someone moves, like these are all experiences related to loss. Some of them can be situational. Some can be perceived or anticipated. For patients that you withdraw care on, that's a good example of when the patient may, or the family may anticipate loss. Like that's perception. Another example of loss would be like a loss of a limb. It has nothing to do about death. It literally is deprivation of an object or person. But the important thing that we need to realize here is that grief just doesn't solely focus on death. I'm sure you guys are looking at this and going, what the heck, right? And give me a second. I'm going to explain. So grief follows this continuum. And there are theories like Kubler-Ross and Bowlby and Worden. And they all really are about how people process grief. And for nurses, what you have to realize is that it follows this timeline, right? And they go from one stage to another. So they go from here to here, or here to here, or here to here. But what's really interesting is sometimes you can fluctuate between theories. So some people can go from denial. Instead of going to anger, they just go to grief, and then they go to bargaining. So they actually jump theories. So I'll give you an example. For instance, several years ago, I lost a really close friend of mine who was really young. It was something that was virtually impossible to think about. He was 28 at the time. And looking back on it now, I just realized that I didn't follow this one, or I didn't follow this one, or I didn't follow this one. I actually jumped in between some of these. And I never stayed in one stage long. And except the one I probably focused on was this one the most. And it was just because, it was difficult for me to figure out how to process what he was to me, and how I could take that legacy and I could move forward and apply it to different things in my life. Eventually it did. And I learned to appreciate what he did, particularly awesome for me. But the thing that you're going to have to understand as a nurse for your patients is that like these are never straightforward. You're never going to have someone that totally fits the Kubler-Ross exactly to a T. These stages can be short or long. They can go months, hours, days. You're going to jump between theories, and you're going to move time. The other thing to remember is you can go back. Like you can get all the way to acceptance and then go back. And go back to bargaining, right? You can go all the way back to bargaining, and then maybe you can come to depression. And then finally you get back to acceptance. But it's just remember, there's stages, there's theories. Every theorist that came up with these had ideas behind it. But what you need to understand as they focus is that there's stages. They go along a continuum, and they can change by going backward. It's not, it's not a one size fits all. And that's what you need to recognize as the nurse. As a nurse, you need to understand that there are several influences on how patients respond, how they maybe adapt, or how they overcome grief. And like, for instance, age is a big one. Older people tend to accept death a lot easier than younger people. Their stages of grief may be shorter. Their entire grieving process may be shorter, whereas some people take years or decades to get over death or loss. Some people are better equipped with better coping mechanisms and coping tools. Like they've been given these through maybe their life experience. Socioeconomics play a huge factor in in grief processing. If they lose, like for instance, let's say they lose a family member, and then they have, let's say they lose a family member in like a fire, like a house fire. So now you've got this fire, they have no house, they have no home, and they've lost family members. These things compound grief. Like grief is not this one single faceted thing. It's multifaceted. It has multi-layers. So don't always expect people to, compartmentalize and say this one family member, I'm going to process this one family member. It's like they have a lot of people have things going on, like the stress of being in the hospital and having to pay for, hospital bills, or if they have to, go do all these other things and they have all these other socioeconomic factors at play that can make it a lot worse. So it may take a lot longer for them to grieve their loss or their losses. Culture and ethnicity are players in influencing grief and loss. Like some cultures are big on celebrating life, and they actually don't look at it in any sort of negative way. It's all positive. So just understand that they celebrate life and that some people process it differently, and they're definitely not going to fit those theories of grief. And this spirituality is another big player on grief and acceptance. People that are religious or have spiritual beliefs, they really that influences their ability to process grief, and sometimes it's going to change how they go through those stages. And for a lot of people, they actually provide faith and hope, often at a level of comfort, especially during times of grief. So how do we help our patients when they grieve? Well, the first thing you can do is you can give them support. You need to find out what the patient or the family needs at that particular time. Sometimes it's just maybe they need a soda, or maybe they need some snack, or maybe they need some tissues, or maybe you just need to leave them the hell alone. Just ask them how you can help, and that's the biggest thing you can do. Use your therapeutic communication. There's another lesson on that. Make sure you check that one out. But use those tools in your therapeutic communication toolbox and figure out how to help navigate them. You also want to make sure you're providing resources and promoting resources. Do they need chaplain? Do they need grief counselor? Do they need another healthcare professional? Just ask them. Another big thing is you also want to make sure you're managing your patient's symptoms. Don't forget to still be their nurse. If they have an illness, an injury, or a disease, make sure you're still managing them and maintain their comfort. If you've got a patient that's, I had this several times where you would have people that were in car accidents and they were maybe the sole survivor. They're there because they have an injury and they've lost their partner, or their spouse or a friend or whatever. They're dealing with grief and they're also dealing with this injury. Make sure you don't forget about this guy. Like, this is really important. So make sure that you're doing that as well. And probably the most important thing is this guy right here. Give a damn. I need you guys to, when you go in your hospital, you need to give a damn about your patient. You need to give a damn about your family. There's absolutely nothing worse than a nurse who is apathetic to a patient or a family member, and especially through the grieving process. Like, they just become so detached. Like, don't be that nurse. I need you guys to go in there and ask them how you can help. Sometimes they just want to hold your hand. Sometimes they need a hug, and sometimes they just want to be left alone, and that's okay. But just make sure that you're asking them and you're finding out. You ask them, how can I help? This guy right here. How can I help? This is going to help your patient probably in one of the most ways, especially during the time of loss. Today, we've really focused on coping, and we're talking about grief and loss in your patients, and then also how you communicate with them. Let's recap. So remember that grief varies. It's influenced by a lot of factors. There's things like age and culture and spirituality, and it looks different for everybody. Grief is the emotional response, and it's not always about death. And just remember that you're really helping a patient to process through some sort of loss. It's the response to loss. People can change, so don't forget your theories. They can change between your stages and theories. They're not universal. You can bounce back. They vary in time, so don't forget that. Don't be apathetic. Give a damn about your patient and your family. Get in there and support the patient, family. Ask them, how can I help? And the last thing, grief can be unhealthy. Just because it's a process doesn't mean that the patient can't have some sort of long-term effects. Sometimes they need additional help. Sometimes they need extra resources. Go in there and provide those resources as necessary. The other thing I want you guys to do is go check out the mental health lesson on grief, which really focuses a lot more on unhealthy grieving. That's it for this lesson. Make sure you check out all the resources attached to it and go out and be your best selves today. And as always, happy nursing.